Right now, for people battling other illnesses, routine hospital trips feel a lot different. Victoria Moranin spoke to a woman who has cancer and fears there won't be room for her in the hospital.
Kate Peck was diagnosed with breast cancer in May, right in the middle of a pandemic, which means she is more at risk of getting sick with COVID. Now, it doesn't stop there. Peck had to have surgery done right when hospitals are reaching capacity.
It's a very isolating event.
Kate Peck went in for a partial mastectomy. Upon drop-off, her hospital was a ghost town.
The waiting rooms are very empty. When you come in to check in, you're given a surgical mask and, you're not allowed to wear your mask, which makes perfect sense.
It took some adjustment, but to Peck, some protocols appeared the same.
The treatment is the same. They're still very gracious, very caring. It's just that they strictly are gloved up and masked, and there's all the sanitation that goes in between.
On a physical sense, her procedure went well, but emotionally, recovery took some time.
I think the hardest part for me was coming out of surgery to an empty room because they won't allow you to bring family with you anymore.
Especially with the condition she is fighting.
When you're diagnosed with breast cancer or any kind of cancer, there's an uncertainty there and, a little bit of fear.
Fear that Peck initially had before she was admitted.
I certainly didn't want COVID to kill me before cancer did, because I would really be upset.
That was mollified by the changes made.
I know that the facilities are doing everything they can to keep patients healthy and safe, to keep their doctors safe, to keep their staff safe. We're probably healthier and safer and cleaner now than we were before COVID, because people are really making an effort to clean.
Peck didn't have to stay in the hospital for long. For COVID safety reasons, her surgery was treated like an outpatient procedure, which means that Peck was sent home a few hours after her surgery. Back to you.
Well, we reached out to Health and Human Services for an update. Here's what they told us about the number of available beds here in Texas. Right now, there's more than 8,600 COVID-19 patients in Texas, and hospitals still have around 12,000 beds open across the state, as well as another 1,200 in the intensive care unit.